Oh, what a good girl. Yeah, there we go. Wherever you were going to be working, the floor would also be okay. But as we learned last week, a lot of dogs, if we don't have a squishy other surface, it's a little harder for them to settle. So I will have you, if your dog is really reliable with this, you can start to replace that settle cue with the deep pressure therapy cue. The way I would do that is pairing them. So let's say that I've got my towel on my chest and I've been saying settle, my dog to go out there. Once this is reliable, I'm going to place that towel and I'm going to, if I wanted to call it cover, I would say cover, settle. So I'm going to say the first, the DPT cue will come first, the less familiar. Then I'll pause briefly so that they stand out as separate words, and then I will cue that settle. All right, so I will have everybody practicing asking their dogs to go settle in their laps or on their chests. And you can reward for a little duration if you'd like. I'm just watching everyone do this a couple times first. Mm-hmm. Right. Yeah. All right.
Okay.
How have you been doing with this one?
Georgie, touch. Touch. She's looking out the window.
Oh, I see. A little distracted.
Yeah. Good
Now,
girl.
good. So I see you have the pillow there to kind of offset the height difference for her, right?
Yep.
Okay. And then do we have her settle mat there as well, or are we just getting her up on partially the pillow and partially your lap?
I have a settle
Oh, okay.
towel.
Okay.
Georgie, come touch. Good girl. Down. Good girl.
All right. I know she's partially on a pillow here, but is this positioning more like what you're wanting versus what she was doing last week?
Yes.
Okay, great. And is she struggling doing the go settle cue rather than, I like that you're using touch. That's a good use of touch to get her in just the right place. But is she just
Yeah,
struggling to use the settle?
she's I don't think she understands settle when the towel is on my lap.
Right? Yeah. Sometimes that is a tough leap to make. Um, so if that's a struggling point, you can use the touch to position your dog. I like settle because it is less consecutive cues that you've got to get the dog
This way.
understanding when you add in that deep pressure therapy cue. But if it's working, then fabulous.
This is
Um,
another position that I think is comfortable for us.
okay,
She
yeah, coming
she
from the other side.
she sits with her butt kind of tucked in so she can see out. And this
Okay.
she gets a little bit more of her weight on top of me.
Okay. So which one feels better for you?
I think both. It just depends on
Okay.
what if I'm it just depends. I think I'd use both positions.
Okay. So I usually would teach them one at a time, just so that we've got some consistency with how they're understanding what they're supposed to do. So I might just encourage picking one of them to give that deep pressure therapy cue to. And then if you're using the other one, you can still use touch to position her how you want. But I'd teach one using the deep pressure therapy cue, and then we could add the other one in later rather than trying to switch back and forth.
Okay.
Sound good? All right.
Mhm. Touch. Good girl. Settle.
Good girl. Nice work, Georgie. And then over time, I'll use less and less cushion underneath her. Okay. All right, but that looks good. Nice work. All right. Claire, I see you could unmute here, so I'm gonna check in with you.
Yes, the cat just went. Rosie just left to go find the cat.
Yes, I saw her gleefully launch.
Yeah,
Hi,
she's
Rosie.
back.
Yeah.
Full excitement.
Mhm.
Come here. Good girl. Good.
Good. Okay.
So we hadn't practiced on the couch before. I've just been sitting on the ground practicing with her. So I found it changes her positioning a little.
Okay.
But this seems to work. At first she was I don't know if my camera's showing her well enough actually, but at first she was kind of having her elbows a little farther back and it felt like all the pressure was on one leg and not the other.
Oh, uh-huh.
And
Okay.
there she's a little bit more even.
Okay.
A little there. Also, I discovered that she seems to prefer coming from the left. And I realized that when we were practicing on the ground,
Mhm.
I was practicing with her moving on from the left every time. So when I
Yeah.
sat on the couch at first, she was on my right, and she was like, "This is not the direction from which we start. I need to move
Right,
to her
right.
side."
Yeah. Yeah. Sometimes we have to help them understand there could be another definition for that same behavior. That we go
Right.
from
So
different
yeah, she
direction
sort of
or
showed me that we're going to need to
Mhm.
purposely train from both sides if we want that.
Absolutely. So nice cat. I was thinking with her elbows being a little further back in the past, that if that continued being a problem, I might shift where the blanket is, the towel across my lap. So the side she's coming from, I might make it a little bit shorter so that she was inclined to go further onto it.
Mm-hmm.
It was extending past my lap on both sides. Does that
It
make
makes
sense?
sense. Yeah.
Encourage her to go a
Yeah.
little bit further. But then secondarily, I could try using a follow-up touch or treat lure if I needed to get them in the right position before beginning to reward for a little bit of duration.
Yeah. That's what I was doing, was helping her position with either the touch or the treat.
Okay,
And this is,
fabulous.
yeah, this seems like a more even distribution of weight
Yeah.
now
And
that
with
she
her
has her
elbow.
elbows all the way across. Yeah.
Yeah.
I
Mhm.
think
That looks
she
good.
might be a little more comfortable the other way though, with her elbows like
Got it.
on my lap, but I don't
Mhm.
think this is too uncomfortable.
Okay. All right. Well, I would encourage everyone to just, let your dog work up to more duration if we think that they're still getting used to the position. Um, and over time, I find that our dogs tend to also experiment kind of with like, well, if I just turn my weight this way a little bit, then I'm still in position, but I feel a bit more comfortable. So they tend to kind of figure out how to just adjust little bits to get themselves more comfortable as well.
Yeah.
Okay, lovely. So, and for everyone else, if you ever have an issue with your dog's elbows just being really pointy, or if anyone later is teaching a chest DPT, if that's a challenge for you, you can work separately on teaching your dog to roll onto their side for some sizes of dogs. And that might be a good thing to add into the deep pressure therapy, depending on your dog's shape and size and how pointy the elbows are. Um, Luca, I see you could unmute at the moment, so I'm going to check in with you. So, Inez, you two just look very comfy over there. All right, so Luca, how are we doing?
We're doing all right.
Okay.
It seems like she's kind of sliding off a little bit though. Papa, touch. Right, can I help you change position?
Oh
Okay.
my
Well, this is like
goodness. So
half.
do you feel like she's just like sliding forward off of your knees?
Yeah, so like if she is
Yeah.
cross, she's just kind of sliding down that way.
Right. Uh-huh. Yeah.
It
So,
seems worse when we're on the floor.
oh, interesting. Okay. Yeah. So she might be one of those dogs that we need to problem solve a little bit with positioning. So sometimes it really
Okay.
is just about the shape of the human, the shape of the dog, which all of us are different. And so just how our dog is positioned can need to be tweaked a little bit to help them keep their balance and feel comfortable. So I would recommend trying, especially if she's less stable on the floor, I might practice on a bed, trying to see what positions, like if we can tweak it in some way that helps her be a little bit more stable. And for
Okay.
sure, she may be a good candidate for the lay on your side.
Yeah.
Selena's, I do want to give you a chance to check in, but I know you guys look very cozy. So this is where, yeah, this is where the off becomes helpful. So for anybody still practicing, I encourage folks to experiment with the can my dog do off as a cue while I'm there. Because then, especially if anybody is like the dog's elbows are digging in and it hurts, or like if they were on your chest and you realize that you couldn't breathe as well as you needed to, or anything like that, we do want a reliable way for them to get off. I'm not faulting you in any way there.
No,
good
and
thing
he's
to
looking at the window. Rest. Yes.